Do you know three cough medicine? Dextromethorphan, guaifenesin, last one codeine. Dextromethorphan suitable for cough in adult and children over 6 years old. Act on the cough center in the brain and reduce cough reflux. Common side effects include dizziness, drowsiness, and nausea. Guaifenesin suitable for bad or productive cough to loosen and clear mucus. Work by thinning and increasing the flow of respiratory tract secretion. Usually a well tolerated medication with few side effects. Codeine suitable for persistent or severe cough but not recommended for children. Suppress the cough relief by acting on the central nervous system. Common side effects include drowsiness, constipation, and nausea. Thanks for watching Medical Hub channel. Like, comment